Okay, so I am with Claudia, she's 44. As you can see, I'm looking at her through a mirror. I lack the projection of the face. If I look at her face to face, maybe I won't see exactly the same thing. So light and shadows, as I told you, very important. So this is a classic case. Obviously, she's 44, never done anything. You come for the first time, you've never done anything, right? And obviously, she's complaining about losing a bit of volume on the mid-face here. And I don't know if you can see the chin area is a bit tricky. I definitely would do, personally, some Botox in the chin muscle, because it's puckering a lot. And you see what an hyperactive chin muscle can do, creates lots of damage, okay, after time, because it has created dents here. Do like this. You see? All this deep line, this horizontal line, all breakdown. So you see, mechanically, a muscle can be extremely aggressive and create lots of damage on the lower face. So obviously, if I look at this patient for the first time, definitely I will do some cheeks, and definitely I will have to do, because where I have the most shadows, it's here. I don't know if you can see that. It's definitely here. So if I improve this and I leave the lower face here, something will be wrong. It's not harmonious. So think about the puzzle, all the pieces has to join up together. So we're going to lift cheeks and the chin area. I will do micro-puncture incision here, and one here. I'm going to use Teocial Ultra Deep, right? Okay, so let's start.
Jean-Louis, a question.
Yes?
If you use Botox before or after injection with HA?
At the same time. No
the
problem
same
for me.
session?
I can do it after or before.
Okay.
Here, today now, because I don't have Botox, I'm going to do some fillers in the chin for you. I will show you also what you can do with a chin volume restoration with fillers in the same time. Okay? So obviously, if I had to do the volume restoration of the chin with fillers, I won't do Botox the same day.
Okay. Thank you.
I will do that before, eventually, to stabilize the muscle. Okay? Because if you do Botox on the chin, you should stabilize the muscle in a lower position like this, and then I will adjust exactly the volume after. But today I'm going to do some chin enhancement. So I avoid the eye socket area. You see, we are talking about cosmetic units. Okay, this is the eye socket area. This is the temple area. You can see. And this is the cheek area. Okay, this is the chin area. This is my point. Sorry. You're fine if I turn?
Yes, all okay.
Yeah, get rid of this. I don't need anesthetic cream because I don't deal with the skin. So it's not interesting to have anesthetic cream. See, the mandible, the malar apophyse here, halfway through. Voilà. This is the way. This is the way. Right. So, introduction of the cannula, here. I'd rather make it invisible. You never know. Why having a visible marks on the face if you can avoid it? Okay? So that's... And I'm going... Alors, now, instrument. I definitely use cannulas. You can't do that with classic needles. My favorite size of cannula is this one, is the blue one, which is the 23J by 70. So small anesthetic here. Xylocaine and epinephrine 2% usually. One dot here in the chin area, in the crease of the chin area. Okay.
Jean-Louis, if I understood you right, you prefer ultra deep, for you think that Ultimate is such a good product that it is too long
No, it's not
lasting.
such a good product. I like also the density, the flexibility of Ultra Deep. I think sometimes Ultimate can be a bit too rigid for the face. I like the plasticity, the flexibility, as I said. It's, for me, it's more natural, and I'm more comfortable with it. Because sometimes it's difficult to spread the, it's quite thick, the Ultimate. So I make a needle hole, as you can see. Tiny, almost invisible. Introduction of the cannula. Hold on. I try to show you. I'm underneath the skin. If I leave, you see, you don't really see the cannula. It's not too superficial, okay? So don't scratch the skin. Because I know for you, it's always the issue is how deep you should be. Okay, you're really in subcutaneous tissue, as you can see. Okay, I don't see my needle, huh? Right? So I'm quite quick. I'm going to show you. I have, with this cannula, I know exactly where is the way out of my cannula. I have a little mark here. If not, you have to make a mark. So I show you, like a fan injection. You see, and I'm used to, and I'm quite quick.
So here we are in the subcutaneous layer.
Voilà.
There's not a very deep injection. It is subcutaneous.
Voilà, it's quite quick. It's done. I'm going to use the Teocial Ultimate for the next patient, which need a serious volume restoration. So, and we need lots of products, lots of quantities. So in this case, it's more sometimes interesting to use Ultimate, even for economic reasons. Second check.
How many ml you put?
At the moment, I put 1 ml on the right side.
On the right side, okay.
Give me a swab, proper, a clean one. Tissue, whatever. Okay, introduction of the cannula. See? Okay, I'm quicker now. So I'm doing at a normal speed the way I work in my office, at my office. To show you a normal procedure. So it's a syringe of 1 ml. I'm more used to 1.2 ml. Maybe I will miss a little bit of filler. I will see at the end, do some adjustment. I'm not going to do the temple on these patients. I'll do it on the last one. Okay, can you put the table a bit down? No,
so
whatever.
So I think for the mid phase,
Stop.
I think you usually use cannula technique. Is it right?
I always use cannula technique for everything.
Okay, thank you. For otherwise, in this area, in this
even for the nasolabial fold, now I use the cannula. For the chin area, I'm going to use the cannula too.
Okay.
No, orange.
I think everybody who can use cannula should use cannula.
For the chin area, I'm going to still use Teocial Ultra Deep, but I'm going to change the size of my cannula. I'm going to use for 25G 50 mil, the orange one. So they're slightly shorter, 50 mil. I like longer cannula normally, and it's done already. So this cannula has no, you don't see, there's no mark for the way out of the needle. So you have to know exactly where you are and where the filler is going out. So you see that's the way out. So I put a mark here, so I know exactly where I am. So important to see where the product is coming out. Okay, not on the side, not on the back. So you need to know where you are, and you need to control exactly what you're doing. So chin, give me a, pick myself.
And when you inject, where should the opening of the cannula should be?
Sorry?
The opening, the hole of the cannula, where should it be? To the depth?
Superficial.
To the superficial side.
German.
Okay.
Yeah, I did that. Can you see here?
Yeah.
Put your chin down. Put your chin down. Yeah, like this. Okay, that's the needle hole. Right? Can you see it?
We see everything.
Okay, take this. Introduction of the cannula. Not too superficial, not too deep. If you are too superficial in this area, you'll create a lot of bruises. Okay, there's a skin retraction in this chin area, so don't go too superficial. Don't scratch the skin.
For some indications, do you use smaller cannulas?
On the chin area, I use smaller cannula.
No, and on other areas?
I can use thinner cannula for the nasolabial fold eventually, or the orange one. I don't like when they're too thin also, because when they're too thin, people are frightened usually. They have a tendency to use too thin cannulas and too short because they're frightened. And that's not a good idea. It's like in surgery. The bigger the instrument, the safer. Which means when you have a very too thin cannula, you have a tendency to go very, very superficial. People, I don't know, there's like a reflex that they want to stay close to the skin. But that's not a good idea because you will scratch the skin and you'll have lots of bruises. So it's not a good idea. So don't go too deep, but don't be frightened. It's fine. Nothing's going to happen. If you're in a subcutaneous plan, you have to have this feeling. It glides. It's slight normally. It's easy. Give me one more. So I've done the side of the chin area. Okay, as I told you, normally I should have done some Botox before to stabilize the muscle, but I'm still in the needle, so I'm going to try to reshape the chin. It's interesting to reshape the chin because there are lots of dents here, and it's a bit short compared to the nose. So a quick adjustment of the chin could be interesting.
But it's always the same hole where you go inside.
Yes, always the same hole. You see, with one hole,
you use only
I'm very
the
zen,
needle
in fact. With one hole, I can do a lot of things.
Yeah.
So I try to reshape the chin. So I am on top of the muscle. So there is some also chin augmentation where you will have to be underneath the muscle like a proper implant, like a liquid implant. So this is more like a chin reshaping. Start being correct. See, I see all this dent here created by this very aggressive muscle. So this lady should have Botox injection long time ago that would have prevent all these dents. I think it's quite correct for the first case. So it took us like what, 5-10 minutes? Can you stand up, please? Let's have a look at the cheeks. Now, if it's insufficient, I'm going to go back and put some more. Smile. I think it's fine. We have this inverted triangle, as we mentioned earlier. See the chin area? So much better. You see the chin area? So, honestly, she needs, which patient is she really need a drop of Botox on the chin? That'd be so helpful to finish the work. Okay, that'd be a great thing. Voilà, soft improvement, okay? Nothing spectacular. We don't want this caution face. It's, as we said, volume restoration, not augmentation. Okay, that's the key word. I think people are really confused with this, or they're taken away by this power they have to put fillers in the face, okay? So don't be carried away by the fact you can put a lot of filler. It's not the point. It's not interesting. Okay, so the definition of word is really important. It's volume restoration. Put that in your mind, grave it in your mind. It's not augmentation. You may need to do augmentation. Some patient will ask for augmentation, okay? But your job is aging maintenance, is to preserve the aging process, to slow down the aging process. So therefore, most of the patients, they don't want to age, but they don't want to change. So please don't change them. They didn't ask you to change them. They won't stay the same. So keep that in mind, please. So that's the real damage for all our professions. Okay, people are doing too much. Okay, they don't understand what they're doing. No augmentation, restoration. It's not beauty, it's maintenance. Smile. I think it's enough. That's it. Okay. And the chin area is much better.